or something like that. So yeah, we can talk about that too. All right, you ready?
Good afternoon. So today my name is Grace Knutinen, and I'm an interventional radiologist here at Mayo Clinic, Arizona. And we're here today to talk about pelvic congestion syndrome, also known as pelvic venous insufficiency. And as a woman and as an interventional radiologist that treats women with pelvic congestion syndrome, I think it is a disease that is underdiagnosed, misdiagnosed, and for sure sometimes mistreated. Pelvic congestion syndrome, briefly, is a condition that is seen, and symptoms typically present in women who have chronic pelvic pain for greater than 6 months. And they describe the pain in their pelvis as being full and feeling very bloated and very swollen. For many reasons, because there is no visual on what's going on inside of a woman, that's the reason why it is underdiagnosed. I'm very lucky, I'm very honored today to have one of my patients, Christina Dennison, because I think it's very valuable for a lot of women out there to really hear it from someone that was diagnosed with it and then was treated for it, and to see from her perspective how she is doing today. So with that, Christina, if you want to introduce yourself, and then maybe talk a little bit about the pain that you were feeling initially before we sort of came up with a diagnosis.
Yeah, I'm a mom, so, just going through day to day, I really need to be able to stand and take care of my kids. And it was something that for me kind of just grew over time. And in the beginning, I remember it was just like a burning sensation. And I started thinking about watching it, and sometimes I wondered, is this a bladder infection? I feel confused, and then all of a sudden it started becoming like a sharp pain and just that swelling feeling of engorgement inside. And then some days it was so painful, I would just have to lay on the couch and feel like I can't even take care of my kids. I need help. This is unbearable at times.
Now, is there was there a switch that you kind of said to yourself, I really need to find a solution for this?
Yeah, I really wanted to be there for our kids and be the mom that I should be and be able to take care of them. So I was, kind of just drove me to reach out here to Mayo Clinic and find answers to what was going on.
So I think that's really a very important point, is I think that women sometimes we're very good at taking care of ourselves and our children, and then sometimes we let these things dwell until they really impact our quality of life, like you not being able to take care of your children. Yeah. And I think that women really need to know that there is a solution and there is help in terms of trying to find the reason, right. And knowing that there is a treatment for it. Now, were you initially, would you say, when you saw me in consultation, would you say, were you a little bit scared? Did you know what pelvic congestion was?
Right. When I got to Mayo Clinic, I was referred to Grace, and they mentioned possibly it could be pelvic congestion syndrome. And my mind was like, whoa, what I have actually has a name. That's pretty sophisticated. I was like, wow, they're really on top of it. They know what it is. I don't even know. It was the first time in my life I had ever even heard of it. So before I went and saw you, I did do a little bit, but I didn't know what was going on. So I remember you showed me imaging, what was happening inside, and you're like, oh, here's your gonadal veins. So I was like, I didn't even know I had those. It was something that was so new to me, and I remember you said a lot, but I don't remember what you said because I'm very visual, so it just threw me off for a loop. I was like, what is going on? And so part of me was fearful, but part of me was so happy because for a long time I didn't know what was happening. So it was like kind of the mystery was solved, and I was like, wow, this makes sense. Like, okay, I feel like we're on the right track.
Now, how would you describe pelvic congestion syndrome, in lay terms, if you were to tell the women out there?
Basically, the varicose veins in your legs, the valves don't work and they dilate and they fill with blood, is what you have wrapped around your uterus and your ovaries. And that's that swelling feeling because the blood is just pooling in those areas where the valves have just they're flip-floppy and the blood is there and you can't really, it's all in this area that is just makes you not want to move. You just don't want to even sit.
That's an A+ description.
Thank
So
you.
I think one of the important things sort of to summarize is really that, sometimes a lot of us, we see varicose veins in people's legs, and that's just because the valves are not working and the veins dilate and they become visible in the legs. There's also an equivalent in men, and you also see the dilatation, and that there's actually a physical finding that you can see in men with this condition. In women, it's very different. You can't see on the inside. And that's really where you have to start to tease and really believe the symptoms when a woman comes to you with these particular descriptions. And so I think that's really, really important, to tell women out there that, there are people that, the people really need to be specialists in this particular syndrome. One of the things that, we do here at Mayo Clinic, and I don't know if it, helped you as well, is that, one of my colleagues, Dr. Rami Oklu, actually does a lot of 3D printing. And so, one of the things that we offer here is that we can actually customize and show patients what the syndrome actually happens in their particular body. And this happens to be, a 3D printed model of what happens in pelvic congestion syndrome. And so we can see, the vein actually as it runs down can get compressed and it can become engorged within the pelvis. And so I think, Christina, you can speak to this, whether, it's really valuable, I think, when you come for a consultation, that you see what you look like on the inside. And so therefore you get a little bit more familiar with what the treatment plan is going to be and, getting you to feel a little bit more comfortable and at ease about what's going to happen, once you kind of see, a 3D printed image or, the pictures on the screen.
Right.
So were you initially, scared about going forward with the procedure?
No, I was excited actually. I was like, let's fix me. But I had never heard of interventional radiology as well. So that was something new to me, and just learning about where modern medicine has taken us to the point where we can go in through a small hole in your body, treat those veins, and it's an outpatient procedure, was really big for me because I have kids to take care of. I need to get back to life. I need to get up and running. So I was very, excited about that,
Yeah, I think it's interesting. A lot of people out there, they don't really know what interventional radiologists are. They actually think radiologists, we all sit in dark rooms and, read films all day. But I don't like the dark, so. But interventional radiology is really kind of a specialized field where we do these minimally invasive procedures and help out a lot of people.
Yeah.
So kind of switching gears a little bit, how was the procedure? Was it doable, manageable? What would you like to tell, the ladies out there?
Yeah, I was in and out the same day, and she treated the veins, like I said, through a small hole, and was able to go in and specifically find what was causing the issue. And then I just remember everyone on staff was really helpful. Everyone made me feel comfortable and answer all my questions, and the whole procedure, Grace was very gentle, and I just feel like I was comfortable the whole time. So, yeah.
And then how did you feel after the procedure?
After the procedure, I walked right away. So we actually,
that's a good sign.
We went to the hotel. I walked in, and we actually spent the night. We had a date night. We don't really get those, so we took advantage of the babysitter and kind of stayed overnight at the hotel and just hung out and everything. So the recovery was great. I was walking at the park with the kids, a few days later, and it was like I could get back up. Nothing knocked me down, so it was great.
And then how long do you think, it took where you were like, wow, this is, a real life-changing treatment for you?
For me personally, it took, I would say, a few weeks until I started noticing it. But man, it was like I went from down and then it just kept getting better and better. So yeah, it was amazing. I felt like Superwoman a little bit. I was like, I could do so much, and it was great. So yeah, I one day I remember, because I couldn't stand past 2 o'clock, and all of a sudden I was like, whoa, it's 7 o'clock at night. This is huge. This is a big deal for me to be able to stand all day and have the energy to take care of everybody and be there for everybody. And all my kids, they were very happy. So
that's awesome.
Yeah.
Is there anything that you feel that you want to say to the women out there that might have problems with pelvic pain?
Yeah, I know where you're coming from, because I would say it's something that women don't want to talk about, but that's the reason I wanted to come here today, because I want to help you guys be able to, if I go out there, I would have liked someone to have done that. So I'm doing that because I want to be there for you guys, and I'm putting myself out there, and it's nothing to be ashamed of. It's actually something that there's help, and good help, like specific. I think in the back of my mind, I never really wanted to talk about it, and I want to make sure it was the right provider, because I was afraid of having some invasive surgery where they would have to remove my ovaries and my uterus, and I've heard of stories, and I know of women who've had that happen to them, and they still have the pelvic pain. So for me, in the back of my mind was, I want to make sure it's the person I trust, and I just feel like, having a woman interventional radiologist was a plus, because I could trust, and I felt comfortable enough knowing that nothing was going to be done that was unnecessary for me. So I just feel like, reaching out, you're going to get the right care here at Mayo, and with Dr. Grace, or, I know there's other locations, but, yeah.
A question, how did you, what was your path to finding an interventional radiologist? That's not usually or typically your first line. So can you talk a little bit about when you noticed that something was wrong and that you weren't able to take care of your kids and you wanted to do something? How did your path go? Who did you call first?
Yeah, I would say I thought it was a bladder infection, and I went to see my PCP, and then they gave me a list of diagnoses it could be, and I just knew it wasn't those specific things. And when the test came back negative, I said, I'm going to call Mayo, and, they have a vein clinic, so this must be, from pregnancy, they tell you pelvic varicose veins are normal. And so that's just, some women have that, and so I thought, okay, they have to deal with veins, then I'll go there. And so then the doctor referred me to Grace from there.
Yeah, and I think it's, really important, pelvic congestion in general, the syndrome is much more common in women who have had multiple pregnancies, but I have seen it in women who, just have one child. And that's really because of, the hormonal fluctuations that can cause the valves to become incompetent, to become floppy, and then they don't close, and that's why you get the accumulation, of the blood in the veins that are surrounding your pelvis and your uterus. So it's definitely something that's more common in women after they've had children.
We have a question from a Mayo Clinic Connect member. If I have this syndrome and I'm having a lot of pain whenever I exercise, should I give up exercise?
So you should never, give up exercise. Pelvic congestion syndrome in general, the pain, sort of as Christina mentioned, kind of worsens by the end of the day. And the reason is that because you're standing, so all the blood is kind of accumulating in your pelvis. So it's definitely not a reason to stop exercising. It's definitely not causing you harm. I think if you are exercising, in the afternoons or the evenings and you have this particular syndrome, there's probably a reason that you might be having that pain, and that's just because, you might have pooling of the blood in your pelvis.
Can you talk a little bit more about the symptoms somebody might perceive if they have this syndrome?
Yeah, so the symptoms tend to be, again, the pelvic pain that's described is, fullness, bloating, heaviness. You can have back pain, and again, it's worse at the end of the day. It's a pain that's sort of, is just dull and achy and is just there, and sort of kind of what Christina talked about. You try to take, ibuprofen, you try to conquer the pain, and you can't really, and that's because, the congestion from the veins is still there no matter how much ibuprofen you take. So that's sort of, the symptoms that you have, you have to kind of key in to those particular symptoms.
And one of the risks that you mentioned are multiple pregnancies, but are there any other risks women should pay attention to for developing this?
No, so one of the important things to realize is sometimes that women may initially present with actually varicose veins in their legs. And if they had children in the past, one of the things that you should, or a physician should sort of think about is, that there is a higher level, above the legs. And so it's really important to look from the top down. It's really important to sort of figure out, is it, valves that are insufficient or floppy at the top, and then you sort of treat on the way down. So you treat from the top, and then you sort of work your way down the legs. So a lot of women present initially with varicose veins in their legs, and after you talk to them a little bit more, then you sort of tease out the factors, and you kind of really clue in to what might be causing those symptoms.
I actually have a story. I just ran into an acquaintance, and she was in Japan, and she had varicose veins in the legs, and they did a phlebectomy and told her she had PCS. And so they treated her legs first, and then, going into her uterus, they said that they had to remove her uterus, and that it was a Western kind of civilization kind of thing. And so it was interesting, but she said, I'm not going to do that. And so just talking with her, but she did have that vein removed, and then the pain just came back. So.
Yeah, I'm glad she didn't have a history.
Yeah, me too. I am so glad too.
Yeah, I think it's, veins are like pipes. You kind of have to follow their flow, figure out, where the problem is along the way, and, kind of really figure out a plan in order to treat them.
For those of you who are just joining us, we are here with Dr. Grace Knudten and Christina, one of her patients, to talk about pelvic congestion syndrome from the perspective of patient and provider. So if you have any questions, feel free to leave them in the comments section below, and we will answer as many as we can. Christina, one of the points that you had brought up earlier is that this in connection to your pregnancy, and wondering if maybe this was just how your body responded to pregnancy or a symptom. Can you talk a little bit more about that?
Yeah, I had seen, a lot of my friends had varicose veins, and they had children too, and they seemed fine. They were able to do a lot more than I could, and their veins, sometimes they looked worse than mine, and I was thinking, wow, how is that possible that they had that they could do that? And so I thought, what's going on? What is it, hereditary? And kind of looking into my family history, we found that my grandmother had it, so I just assumed, my husband and I were thinking, that's got to be it. It's just something with, I have anemia, so I thought, okay, maybe it's anemia plus this hereditary thing. I never, really thought any more than that. And that was kind of what the providers that I had all agreed with that. So,
yeah, thank you. We have another question from a Mayo Clinic Connect member. How can I have sex with pelvic congestion? It hurts. Do you have any recommendations for that?
So interestingly enough, one of the symptoms that patients can have with pelvic congestion is, dyspareunia or painful sex. And again, it's due because, you have these really dilated and engorged vessels down there. And so it can hurt for sure. And that's actually one of the symptoms, that is very much associated with pelvic congestion syndrome. And that should, be sort of a clue if you are having, painful sex, if you are having some of these other symptoms, that, we described here, that kind of Christina described to you, you know, it might be something, you know, that you might look into, because that's definitely not something, you know, that you want to be living with. And it could be that there is a simple solution for it.
Thank you. And can you talk a little bit more about the treatment options? We had talked about interventional radiology, but if you could expand a little more on what those options might be.
Sure. So, you know, basically the cause is you have these floppy, dilated veins, and they're not working. And so very similar to what occurs, you know, in varicose veins in the legs is we basically seal off the vein. It's not working, it's not needed, and it's just causing all the pain. And so what we do is, you know, we go through typically through a small little hole in the vein that runs down the center of your body. We take lots of pictures. We kind of identify where the veins are dilated, where the valves are not working. And then we get into the veins, the dilated veins, and then we basically shut them off. We occlude them. It's called embolization. And we basically seal off the vein so that it is no longer floppy. It's no longer going to cause all the symptoms. And so kind of as Christina described, it's typically about, you know, a 1 to 2 hour procedure. It's done as an outpatient. And the majority of the time, because we're getting rid of the cause of all the problems, you know, patients do pretty well relatively soon after the procedure.
And we did talk a little bit about how post-treatment went for you, but any advice or considerations that somebody should consider when they're considering this treatment?
I think, you know, from my perspective, you know, I like to, you know, typically I see women who've had this for a very long time, and they come to me and, you know, it's something that will help them for sure. They've had it for a long time, so after we do the embolization procedure and they go home, you know, their body's going to have to get used to what we did, and that can take, you know, a few days. But in general, you know, after this few days or after, you know, a few weeks, they feel significantly better. You know, I think, you know, Christina, maybe you can sort of, you know, fill in on that too. You know, I know you said it kind of took you a little bit, and then you sort of turned the corner and you're like, wow.
Yeah, I was like, whoa. I'm not a patient person. So to be honest, Grace had to tell me, just be patient. And I was like, okay, yeah, because but it was more pressing because of the kids. You know, I was like, I got to be there. But, you know, I think, you know, when your body needs to rest and if you've had this for years, I think it's easy to think, oh, in one day it's going to be all, you know, but it's a process, and like Grace said, your body has to adjust, so every woman's going to be probably a little different. But, you know, for my case, I feel like I had a little more severity because it was longer time that I had it. So, but I see the results. It's just like, it's there, you know. I know I don't have that pelvic pain anymore, so it was worth, you know, just waiting. And it wasn't like I think, you know, separating that out, like in my mind, the procedure was not painful, the recovery was not painful. It was just taking the time for the blood to move, and your body has to adjust. And so I wasn't in any more pain. It was just waiting. Let's let the blood reroute. And I was just very impatient about that. I was like, I need to have this done by Thanksgiving so I could be thankful.
Yeah.
So, but yeah.
And so are you still able to do all of the things that you enjoyed before?
Yeah. Oh, yeah. She called me, and I was like 2 weeks after I was running, and I was on the treadmill. So I can exercise. I think I lost like 8 pounds from after. I feel like I got off the couch. You know, I used to feel like I was a prison going to the couch, but yeah, I'm kind of set free and delivered of all of that. So yeah, it's kind of something in the past. It's like looking back at it, yeah.
Yeah, from a provider perspective, I mean, I think it's also important, you know, at least when I treat women with this syndrome is, you know, I don't treat them and never follow up with them. You know, I really think it's important. You know, I have a passion for this, so I really want to make a difference, you know, and I know that I was probably, you know, we were talking and, you know, communicating a lot.
Yeah.
It was just, I wanted to make sure, you know,
you did.
Yeah. So I think, it's important, for women who are out there that, make sure that you follow up and, because it's a lifelong, change that can happen for sure.
I have a question from a Facebook viewer. If a woman has tubal ligation, can this increase pelvic congestion?
So typically, again, you have to kind of go towards, the symptoms. There's many reasons why women can have chronic pelvic pain. It could be from endometriosis, it could be from adenomyosis, it could be from many different things, from ovarian cysts, and that's why it's really important to get good imaging. So in that particular situation, I always get imaging in all of my patients. I think it's important to see what might be the cause. It could be something else. Could it be this? So I think that's kind of what I would be as a starting point, is I think there needs to be some type of imaging to really kind of see if that could be causing.
Thank you. And question to each of you, patient and provider, as you are advocating for your own health, what was important for you to look for in a provider from the patient perspective, and how did you advocate for yourself? And then as a provider, what type of information is helpful for you to have as you're treating patients, whether they're tracking something or if they're cognizant of certain symptoms, but what can we do as patients to really help make sure you understand really accurately what we are experiencing?
Go ahead.
I would say 2 words. I would say trust, and I need to know that I can trust, and I really trusted Grace. I think a big thing for me was knowing that I wasn't going to get something unnecessary. I was getting the best option for my body, and so I felt like I could share what was going on, and so I felt comfortable to do that, and so I think it kind of let me open up, because this was something I internalized for a long time, and it was like kind of let the dam open and just kind of, okay, I need to just share this because I need help, and if I don't share, we're not going to get to the bottom of this. So I think for me, just feeling comfortable, and she did make me feel really comfortable, and I trusted her. And then for me also just understanding, like I felt like she really understood what I was going through and the symptoms, and that was a big one.
Yeah, I think from a provider perspective, because some of the symptoms can be very personal, I really, from a patient perspective, to be really open, to really, open up the floodgates about being honest with what their symptoms are. Because a lot of it, for example, we talked about, dyspareunia or painful sex. I mean, a lot of that, sometimes women are afraid to open up about. But I think it's important. I think it's really important for women to be able to be open. I see a lot of patients with the syndrome, and some of them open up and they're very tearful, and they've been through a lot. A lot of people probably weren't believing them about their symptoms. I mean, it really takes a significant impact in women's life. And for me, I think it's just important when they come to see me, just tell me how it is, because I'm really here to help. I really think it's something that women do not need to be scared about. And I think that it's something that is real, and I think it's something that is definitely treatable, and they can have, life-changing effects for sure.
Great. Thank you both so much for joining us today. This information was fantastic. Thank you.
Thanks, Christina, for sure.
Yeah, thank you.